Updated July 2021. Face covering requirements and recommendations. There is no longer a statewide requirement to wear face coverings in most settings. However, other federal, state, or local laws may require face coverings in some settings, and businesses may set their own requirements. Additionally, face covering requirements for K-12 schools remain in effect through the end of the 2020-2021 school year, and face covering requirements for childcare settings remain in effect through June 30th, 2021, or until 70% of Minnesotans aged 16 and older receive at least one dose. People who are not vaccinated, including children, are not required to wear a face covering indoors or outdoors by state executive order, but they are at risk for getting and spreading the virus that causes COVID-19. The Minnesota Department of Health and the Center for Disease Control and Prevention strongly recommends that anyone who is not fully vaccinated continue to wear face coverings indoors in businesses, public settings, and when around people from other households, as well as outdoors when social distancing cannot be maintained. People who are fully vaccinated are not required to wear face coverings indoors or outdoors. However, MDH and the CDC recommends face coverings for fully vaccinated people in few situations. Certain settings may have special federal, state, and/or local legal requirements that require face coverings. For example, the CDC requires face coverings on different modes of transportation, whether it's buses, trains, air travel, as well as healthcare settings, including long-term care settings, may be required by federal, state, and/or local laws and authorities to require face coverings in certain situations. Note that this is not an exclusive list of federal, state, or local face covering requirements. Be sure you understand your region and industry's legal requirements. Certain circumstances, the use of masks may not be reasonable and accommodations should be considered. When face coverings are required by law, be sure to consider exemptions and guidance addressing the specific requirement. Businesses that choose to require face coverings should also be aware that people who have certain disabilities, behavior needs, or other health, mental health, or developmental conditions may have difficulty tolerating a face covering or wearing one safely. The CDC also notes that children under the age of 2 should not wear a face covering, and certain situations like swimming or other activities that soak in or submerge a face covering in water is not safe. Accommodations might include safe alternatives such as social distancing or contactless service options like curbside pickup. Businesses and entities can also set their own face covering rules, and workers and customers may be legally required to follow these requirements. Recommendations regardless of vaccination status. Face coverings are strongly recommended in the following situations: in settings where the high risk of COVID-19 spread or complications from COVID-19 infection, such as a healthcare setting, homeless shelters, and correctional facilities. For people who have symptoms of COVID-19, are encouraged to stay at home, but if they must go out to a medical appointment, they should be wearing a face covering. People who are immunocompromised or a weak immune system, even if fully vaccinated, should consult their healthcare provider for specific recommendations. The protection they get from COVID-19 vaccines may not be as strong as for the people with stronger immune systems.